Welcome to the deep dive. You guys sent in a ton of research on neurodevelopmental and neurocognitive disorders, and we're diving deep into it all today. I mean, everything from like attention struggles in kids to the mysteries of Alzheimer's, right?
Yeah. It's fascinating how development can impact our brains throughout our lives. We'll be looking at how those early differences and disruptions can really have a lasting impact, but also how adaptable our brains are.
Okay, let's just jump right into it. ADHD, one of the sources mentioned this thing about stimulant medications actually calming kids down.
Yeah.
I thought that was interesting. Like, how does Ritalin or Adderall work if they're stimulants?
Yeah, it's kind of a paradox, isn't it? It turns out they actually boost your brain's attention system.
Oh, interesting.
Yeah, they increase dopamine and norepinephrine in the prefrontal cortex. That's the part of your brain that handles things like planning, making decisions, and paying attention.
Oh, okay. So it's giving that part of the brain a bit of a boost.
Exactly. It helps them focus in school, control impulses, and manage all that excess energy. Of course, there are concerns about possible abuse and long-term effects, so it's definitely a decision to make with the doctor.
For sure. Now, ADHD often gets talked about alongside specific learning disorder because they both can cause issues in school, but they're different, right?
Oh, absolutely.
Yeah.
ADHD is really about struggles with attention, hyperactivity, and impulsivity. Specific learning disorder is about underachievement in specific areas like reading or math, even though someone has normal intelligence.
Got it. One of the sources shared a story about this college student, Alice, who struggled with reading comprehension like her whole life. She was obviously smart, but it wasn't until she got assessed that her learning disorder was identified. Made me wonder how often these differences fly under the radar, especially if someone's doing okay overall, you know?
It happens more than you'd think. Many people develop ways to cope and work around those challenges, but it can be stressful. Anxiety, frustration,
Mm.
even shame sometimes.
Right, exactly. Makes early intervention even more crucial. The material actually highlighted direct instruction as a program that's really effective for a specific learning disorder. Have you heard about that?
Yeah, direct instruction is all about being super structured and systematic.
Yeah.
You break the material down into smaller steps and teach in small groups. Teachers give lots of feedback and adjust based on how each student is doing.
So it's like a really personalized approach to learning.
Pretty much. And the research shows it works. Kids with specific learning disorder using this method make significant gains. It's proof that tailored interventions can really make a difference.
That's really cool. We know that both ADHD and specific learning disorder are linked to genetics, but the research also talked about environmental factors, right? Even some controversy around toxins in ADHD.
Right. There's some evidence that things like exposure to lead or pesticide might increase the risk of ADHD. And then there's been research on artificial food colors and additives, but the findings are a bit mixed. Definitely needs more research.
It's always nature versus nurture, never a simple answer.
Exactly. It's usually a combination of genes and environment. But just because you might be genetically predisposed to something doesn't mean it's destiny. Environment interventions, individual resilience, all of these things matter.
Absolutely. Okay, let's shift gears and talk about autism spectrum disorder or ASD. What really struck me was how complex it is. It's not just one thing, it's a whole spectrum.
Exactly. DSM-5, that's the manual used to diagnose mental disorders. It actually combines all those old categories like autistic disorder and Asperger's syndrome into one spectrum now, with varying levels of severity.
Wow, that's a big change. What was the thinking behind that?
Well, the idea was to show that there's a lot of overlap between these conditions, that they're better understood as being on a continuum. But there has been some pushback. Some people feel like it erases the specific experiences and identity of Asperger's.
It makes you think about labels, right? How they affect our understanding of ourselves and others. And speaking of labels, the research touched upon savant skills. Those exceptional abilities sometimes linked to ASD, like in Rain Man.
Mhm.
Are those common?
Rain Man. Well, savant skills, they're actually pretty rare. Only about a third of individuals with ASD. It's important to remember that ASD is a spectrum. Symptoms and abilities are all over the place.
Yeah, that makes sense. One thing that does seem pretty consistent, though, is the difficulty with social communication and interaction and those repetitive patterns of behavior. The research mentioned a little girl, Amy, who just didn't really form friendships. She saw adults as tools, basically, to get what she wanted. It's sad to think about the social isolation.
It is. That's why early intervention and support are so crucial. You want to help individuals with ASD learn those social skills, build relationships, and navigate a world that doesn't always get them.
I know, it's so important, and the research showed that ASD is way more common than we used to think. It's like 1 in 68 8-year-old kids in the US, right?
Mhm. Right. Likely because of broader diagnostic criteria, more awareness, and maybe some environmental factors we're still figuring out. Importantly, though, tons of research has totally debunked the vaccine myth.
It's so important to shut those myths down. So what about the causes of ASD? It sounds like it's still a big mystery.
It is complex. Right now, we think it's a mix of genetic and neurobiological factors, with environment possibly playing a role too.
The research mentioned genetics playing a significant role.
Yeah. If one child in family has ASD, the chances of another child's having it are higher than for the general population. But finding the exact genes is tough because it's probably many genes working together.
It's a puzzle. And what about the neurobiology? What's going on in the brain?
Well, there have been studies showing differences in the amygdala, that part of the brain that handles emotions like fear. Adults with and without ASD, the amygdala is roughly the same size, but people with ASD have fewer neurons in that area.
Wow, interesting. There was a theory mentioned that the amygdala might be enlarged in young kids with ASD, leading to more anxiety and fear, maybe causing social withdrawal, and then prolonged stress and cortisol could damage it, explaining the fewer neurons later on.
Yeah, it's an interesting theory, but we need more research to really get it. We need to untangle brain development, stress, and the social difficulties in ASD.
I see. What about oxytocin? Isn't that the cuddle hormone?
Yeah, oxytocin, it's involved in social bonding, right? Some studies have found lower levels of oxytocin in children with ASD, so maybe that contributes to the social difficulties. Researchers are even looking at oxytocin nasal sprays to see if they can improve social behavior.
Wow. Could we address these challenges at a chemical level?
It's possible, but we have a lot more to learn about these neurochemicals, how they all work together and contribute to ASD.
Okay, so what about treatments for ASD? The research talked a lot about early intervention.
Early intervention is key. You got to use that brain plasticity and get support to help kids with ASD develop skills and reach their potential.
One of the sources mentioned early intensive behavioral intervention, or EIBI, as a method showing a lot of promise, especially if it started early and involves a lot of time.
Yeah, with EIBI, you're talking about 40-plus hours of therapy every week, focused on communication, social skills, and reducing challenging behaviors. The research says the earlier, the better.
40 hours, that's a huge commitment for families.
It is, but the potential payoff is huge. There's research that EIBI might actually normalize brain function in some children with ASD. Incredible, right? The brain's ability to change is amazing.
That is wild. I remember reading about this study with mice. They were genetically engineered to have Fragile X syndrome, a common cause of intellectual disability, and they gave them this drug to improve the functioning of glutamate receptors in the amygdala, and it basically normalized their brain activity.
Oh, yeah. That's some cutting-edge stuff, giving us hope for the future.
Mm.
Imagine if we could identify these disorders before birth and even, intervene to correct them.
That's huge. But, it brings up some ethical questions too, especially with conditions like ASD, where some people advocate for neurodiversity, right? Accepting differences rather than trying to cure them.
You're right. That's a super important conversation to have. As we understand the brain more, we got to think about the ethics and societal impact of our findings.
Absolutely. Now, before we move on from ASD, I want to go back to that DSM-5 change, removing Asperger's as a separate diagnosis. Some people are concerned that people who used to meet the criteria for Asperger's won't anymore, and they'll lose access to services.
It was a controversial decision for
Yeah.
sure. There's still debate. Early studies were saying that a big chunk of people diagnosed with Asperger's wouldn't meet the ASD criteria in DSM-5, but later analyses said that number was likely much smaller.
Still, it makes sense why people would be worried.
Definitely.
Oh.
And besides practical things, there's the identity issue. A lot of people identify with the Asperger's label. They see their differences as strengths and are all about acceptance, not being cured.
Right, like that neurodiversity concept, right?
Sure.
Accepting differences and recognizing there's no one right way for brains to work.
Exactly. It's a powerful idea about inclusion. And even though it's not officially a diagnosis anymore, many people will probably keep identifying as Asperger's and stay connected to that community.
Okay, cool. Let's switch gears again to intellectual disability, or ID. The research shared a story about James, a young man with Down syndrome. He loves things like skiing and biking, but faces challenges in school and work because of his ID.
Yeah, it shows how people with ID have a whole range of abilities and can live fulfilling lives with the right support. The amount of support they need depends on how severe the ID is. Mild, moderate, severe, or profound.
So those categories, they're based on IQ scores, right?
Yes, mild ID is an IQ score between 50 and 70, moderate is 35 to 50, severe is 20 to 35, and profound is below 20.
Got it. But the impact on someone's life is more than just that number, right? It depends on the support they have, their environment.
Totally. Access to education, therapies, and community support, those things make all the difference.
Okay, let's get into the causes of ID. The research mentioned environmental factors, prenatal factors, things happening during birth, and even things after birth. Sounds like lots can go wrong during those critical times.
Yeah, that's true. Things like deprivation, abuse, neglect. If a kid doesn't have a stimulating environment, that can really affect their development. Prenatal factors, like if a mom gets exposed to diseases or toxins during pregnancy, that can also lead to ID.
Like fetal alcohol syndrome. We talked about that before on the show, right?
Exactly. It just shows how vulnerable those developing brains are to harmful substances.
Yeah. Then you mentioned things during birth, like complications during labor and delivery.
Yeah, things like if the baby's deprived of oxygen during birth, that can cause brain damage and lead to ID. And after birth, infections and head injuries can have a huge impact on cognitive development.
Makes sense. Then the research also talked about genetic factors, right?
Right. Certain genetic syndromes are strongly linked to ID, like Down syndrome, which is caused by an extra copy of chromosome 21.
Right, Down syndrome. That's probably the most well-known one. The research mentioned that people with Down syndrome are also more likely to develop Alzheimer's and often much younger. That's really tough.
It is a really difficult reality for a lot of people.
Then there's phenylketonuria, or PKU, which luckily you can catch early and treat with a special diet.
That's right. PKU is a great example of how early detection and intervention can make all the difference. People with PKU can't break down phenylalanine, a chemical in our food. And if they don't get treated, they can end up with ID, seizures, behavior problems. But there's a simple blood test at birth that can detect it, and then they just have to follow a special diet.
Wow, that's incredible. It's like a success story. And then there's Lesch-Nyhan syndrome, right? Another genetic condition.
Yeah, Lesch-Nyhan is way rarer than PKU, and sadly, there's no cure. It causes ID, symptoms like cerebral palsy, and also this really distressing symptom, self-injurious behavior like biting their fingers and lips. It's caused by the recessive gene on the X chromosome, so mainly boys get it.
Oh, wow, that's awful. The research mentioned a fascinating story about Huntington's disease, like a detective story about finding the gene.
Oh yeah, Nancy Wexler and her team in Venezuela, they studied this huge family with Huntington's. They spent years on it, used genetic linkage analysis to map the problem to chromosome 4, and then they finally found the gene. A huge breakthrough. Because most mental disorders we inherit are caused by multiple genes, not just one.
Right, and Huntington's is the one that affects movement, right?
Yeah, it usually starts with involuntary movements called chorea. People with Huntington's can live for a while after diagnosis, but they often need a lot of care later on. And many of them develop cognitive problems too, a type of dementia.
It's a tough one. So let's talk about treatment for ID in general. The research highlighted communication training as really important.
It is. Communication is everything, right? Connecting with the world, expressing yourself. For people with ID, it can be a big challenge. So the goal is to find what works best for each person, whether it's improving how they speak, teaching sign language, or using those augmentative communication devices.
I've seen those. The devices that help people communicate when they can't speak easily. It's so cool.
It can be life-changing.
Yeah.
Imagine not being able to say what you need, think, or feel. These devices give a voice to people who might not have one otherwise.
It's amazing. What about prevention?
Well, early intervention is crucial, not just for ASD, but for ID as well,
Well,
especially what we call cultural familial ID. That's where it's thought to be a mix of genes and a lack of intellectual stimulation in the environment. Programs like Head Start that give kids educational, medical, and social support, they can make a real difference.
right. Head Start, that makes sense. There was a study mentioned where kids who went through an intensive preschool program, plus got medical and nutritional support, they ended up with much higher IQ scores than the kids who didn't have the education part. That's huge.
It shows how important those early years are for brain development. Every kid needs a stimulating environment to thrive. The research also talked about the potential for genetic screening and gene therapy to prevent some types of ID in the future.
Yeah. They talked about that study using mice with Fragile X syndrome. The researchers used a drug to improve the functioning of certain glutamate receptors in their amygdala, and it basically normalized their brain activity.
Amazing, right? It's like,
Hmm.
what if we could identify these genetic disorders before a baby's even born and maybe even correct them?
It's wild. But yeah, there are definitely ethical questions there. It's going to bring up a lot of conversations about genetic engineering.
You're right about that. But for now, let's switch from developmental disorders to those that affect the brain later in life. We're going to dive into neurocognitive disorders. Those are the ones where brain function declines, affecting things like memory, judgment, language, and other cognitive processes.
This is where it gets really personal for a lot of people. We're talking about delirium, dementia, and those can be scary, both for the people experiencing them and their loved ones.
You're right. Delirium comes on really fast, and it's marked by a reduction in clarity of consciousness and thinking ability. It often comes with confusion, disorientation, and problems with memory and language.
I remember the source material talked about delirium being a fluctuating state, meaning the symptoms come and go, which must be really disorienting, right?
Absolutely.
Huh.
It can be caused by things like infections, head injuries, or reactions to medication.
Hmm.
This is particularly true for older adults.
And it's not always a temporary thing either, is it?
Sadly, no. Some people have lasting cognitive problems even after the root cause is treated. It's a good reminder that even if you're confused for a short time, it can have lasting effects on your brain.
Wow, that's scary. Okay, well, let's talk about dementia. The source material used the term major neurocognitive disorder, which seems to be a broader way to describe it.
Yeah, that's right. Major neurocognitive disorder refers to the gradual deterioration of brain function that really impacts your daily life.
And there's also mild neurocognitive disorder, which is newer, right?
It's in DSM-5 now.
Hmm.
It describes a more subtle decline in cognitive abilities, but it's not severe enough to interfere with your ability to live independently. It's basically acknowledging that these changes can happen slowly and that we might be able to do something if we catch it early.
That makes sense. The material had this really moving example of someone in those early stages of cognitive decline. They quoted basketball coach Pat Summitt, who had early onset dementia. She talked about forgetting where she was, having trouble with directions, even to places she knew well. It just goes to show that dementia can affect anyone, even people in their prime.
Yeah, her story is really powerful. She shows courage and resilience. It also highlights how important it is to spread awareness about dementia so people can get diagnosed early and get the support they need.
Absolutely. Okay, well, let's talk about the most common cause of major neurocognitive disorder, Alzheimer's disease.
Alzheimer's is a progressive and irreversible brain disease that slowly eats away at your memory and thinking skills. Sadly, it's the most common cause of dementia, affecting millions worldwide.
Millions. That's a lot of people. The research talked about memory impairment being one of the early signs, like not being able to remember recent events. So you might remember how to talk or things from your past, but you can't remember what you did that day.
Exactly. It's one of the saddest things about the disease. And as it progresses, it gets worse. People have trouble recognizing objects, even familiar faces. Everyday things become really hard, and personality and behavior can change too.
The research mentioned emotional changes like delusions, depression, agitation, aggression, even apathy. That sounds incredibly hard to cope with for both the person and those caring for them.
It is incredibly difficult. It's like losing yourself piece by piece. Your memories, your ability to think clearly, to recognize people you love, to control your emotions. And it's hard on caregivers, both emotionally and practically.
It's heartbreaking. And it seems like it's really common, right? Like, how prevalent is it actually?
Well, just in the US, it's millions of people.
Yeah.
And as you get older, the chances of developing it go way up. By the time you're 85, almost half of people will show signs of Alzheimer's.
Wow, half. That's a lot. And I remember the research said that education might actually delay when you start showing symptoms, but then once they appear, the decline happens faster.
Yeah, it's thought that education builds what's called cognitive reserve. It's like your brain has a buffer, so it can cope with damage for longer. But it doesn't prevent the disease entirely. Makes you think, right? Would you rather have a later onset but a faster decline, or an earlier onset but a slower decline?
I don't know. That's a tough one. The source material also mentioned that Alzheimer's might be more common in women, and it talked about estrogen maybe being protective.
Yeah, there have been studies on hormone replacement therapy, but we don't have clear answers. It's possible that the drop in estrogen as women age might play a role, but more research is needed.
Yeah, for sure. So we've talked a lot about Alzheimer's, but it's important to remember there are other causes of neurocognitive disorder too. The source material actually listed 8 more in addition to Alzheimer's.
Yes, those include frontotemporal degeneration, traumatic brain injury, Lewy body disease, Parkinson's disease, HIV infection, substance use, Huntington's disease, and prion disease. And then there's this catch-all category for neurocognitive disorder due to another medical condition. That includes things like normal pressure, hydrocephalus, hypothyroidism, brain tumors, even a vitamin B12 deficiency.
Wow, it's amazing how many different things can affect our brains as we get older.
Yeah, the brain is so complex and it's vulnerable to so many things, both from inside and outside the body.
Okay, let's break some of these down, starting with frontotemporal neurocognitive disorder.
Right, so frontotemporal neurocognitive disorder is actually a group of disorders that damage the frontal and temporal lobes of your brain.
And those are the parts that control personality, language, and behavior, right?
Exactly. So unlike Alzheimer's, which is all about memory problems early on, with frontotemporal neurocognitive disorder, you often see personality changes, unusual behavior, and language problems first. People can become impulsive or apathetic, maybe do things that are socially inappropriate. They might struggle to speak, understand words, or name objects.
Oh, wow. So it's like a completely different presentation than Alzheimer's. And it sounds like it could be really difficult for families.
It is. It can be really hard for loved ones because it's like the person they knew is changing right in front of them.
The research also mentioned traumatic brain injury as something that can lead to neurocognitive decline.
Yeah, when someone's had multiple head injuries, particularly athletes in contact sports, they can develop chronic traumatic encephalopathy, or CTE.
Right, CTE. It's been in the news a lot, especially with football players.
It's a serious concern, and researchers are trying to understand the long-term effects of these repeated head injuries. Early on, you see problems with thinking and memory, along with mood swings and behavior changes. But as it gets worse, you can see serious cognitive impairment, even dementia.
It's scary. Then there's Lewy body disease, right?
Yes, Lewy body disease is a progressive brain disorder where these abnormal protein deposits, called Lewy bodies, build up in the brain. It's actually the second most common type of dementia after Alzheimer's.
Really? Wow, I didn't realize that. So what are the symptoms like? Are they similar to Alzheimer's?
There are some similarities, but Lewy body dementia has some unique features. In addition to memory problems and cognitive decline, you see fluctuating cognition, visual hallucinations, and sleep problems. People might also have movement problems, kind of like Parkinson's, like tremors, stiffness, and slow movement.
So it must be really hard to diagnose because it looks like both Alzheimer's and Parkinson's.
It can be, especially in the early stages.
Okay. And speaking of Parkinson's, I know that can also lead to neurocognitive disorder, right?
That's right. Parkinson's is known for its movement symptoms, the tremors, the stiffness, and slow movements. But as time goes on, many people with Parkinson's also develop cognitive problems, including dementia.
Then there's HIV. I didn't know that could lead to neurocognitive decline, too.
It can, although it's less common now with the antiretroviral drugs that are available. HIV can attack the brain, and that can lead to a type of dementia that affects thinking, memory, and motor skills.
Wow, so many different things can cause dementia. The source material talked about something called cortical dementia, like Alzheimer's, versus subcortical dementia, like Parkinson's and HIV-related dementia.
Yeah, that's an important distinction. The symptoms and how they progress are different. With cortical dementia, you often see language problems, like aphasia, which is when you have trouble speaking or understanding language. Subcortical dementia affects your motor skills and executive function more, and people often experience mood problems like depression and anxiety.
Okay, that makes sense. We've already talked about Huntington's disease, but the last cause mentioned was prion disease, which sounded pretty scary.
Yeah, prion disease is rare and unfortunately always fatal. It's caused by prions, which are basically misfolded proteins that can spread and damage brain cells. One type is Creutzfeldt-Jakob disease, which causes dementia that progresses really rapidly, along with movement problems and other neurological symptoms.
The research said it's not contagious in humans, except for some very specific circumstances.
Yeah, you don't catch it like a cold. It's different.
Okay, good to know. So let's shift gears a bit and talk about what we know about the causes of these neurocognitive disorders, starting with Alzheimer's.
Well, the exact cause of Alzheimer's is still a bit of a mystery, but we do know that several things are involved.
The research talked about genetics.
Yeah, genes definitely play a role. We have found a few genes linked to Alzheimer's, like the APOE gene. There's one version of this gene called APOE4 that significantly raises your risk of developing late-onset Alzheimer's, which is the most common type.
And then there are the amyloid plaques and neurofibrillary tangles, right?
Right. Those are the hallmarks of Alzheimer's. Amyloid plaques are clumps of protein fragments that build up between nerve cells, and neurofibrillary tangles are twisted fibers of another protein called tau that accumulate inside nerve cells. Both are thought to contribute to brain cell death.
So are those plaques and tangles what directly causes the cognitive decline?
That's what we think right now.
Hmm.
But there's a lot we don't know about how it all works. Researchers are trying to figure out exactly what happens in the brain to cause Alzheimer's so we can develop treatments that slow it down or even stop it completely.
I know they're working hard on that. While we mostly talk about the biological stuff, the source material also mentioned that psychosocial things can play a role too, right?
Yeah. While they don't directly cause the damage, like in Alzheimer's, things like your lifestyle, diet, exercise, and social life, they can all affect how the disease progresses.
So it's like what's good for your heart is good for your brain.
Exactly. And the research also mentioned that different cultures view dementia in different ways.
Yeah, they said in some cultures, cognitive decline is seen as a normal part of aging, so people might not get diagnosed as early.
It's important to consider those cultural differences. They influence how we see and respond to cognitive changes in ourselves and others.
Now let's talk about treatment for these neurocognitive disorders. It's a bit disheartening because for many of them, there's no cure.
Yeah, that's the hard truth. The damage is often irreversible. But that doesn't mean there's nothing we can do. We focus on three main goals:
Mhm.
preventing things that can lead to these disorders, delaying symptoms to keep people's quality of life good for as long as possible, and helping both the person with the disorder and their caregivers cope with the challenges.
The research pointed out that once the damage is done, we can't really restore lost abilities.
It's true. But researchers are working on promising new treatments, things like stem cell therapy and new medications that might help to slow down the progression of these diseases.
Fingers crossed for that. I know there are some drugs for Alzheimer's that can help with cognitive function for a while. The research mentioned cholinesterase inhibitors, right?
Yes, those work by increasing the amount of acetylcholine in the brain. Acetylcholine is a neurotransmitter that's really important for memory and learning, and in Alzheimer's patients, there often isn't enough of it. Cholinesterase inhibitors can give people a boost so their cognitive function doesn't decline as fast, but the effect is temporary, and unfortunately, the disease keeps progressing.
And there are also medications that target those amyloid plaques, right?
Yeah, those are newer, and they look promising, but we need more research to see if they really work long-term and if they're safe.
What about some of those alternative things you hear about, like ginkgo biloba and vitamin E? Do they work?
Unfortunately for ginkgo biloba, the research is all over the place. Some studies say it helps a little, some say it doesn't do anything. And for vitamin E, people were excited about it at first, but now studies are saying that high doses might actually be dangerous. So doctors don't recommend it for Alzheimer's.
So maybe stick with what we know works, like a healthy lifestyle.
Yeah, that's always a good bet. But what about psychosocial treatments? Those can make a difference, right?
Right. They can't reverse the damage, but they can help people live better.
Exactly. They help improve quality of life and provide support for both the person with the disorder and the people taking care of them. The research mentions some cool things like memory wallets.
Memory wallet.
Yeah, they're basically personalized tools to help people with Alzheimer's. They provide information and cues to help them navigate conversations and social situations.
Oh, that's a great idea.
It's a simple thing, but can make a big difference. And technology is getting better at helping people with dementia, too. Think tablets that can remind people of things, give them cues, even speak for them.
Wow, that's incredible.
Right. It can help them communicate and feel less frustrated. And then there's cognitive stimulation, which is basically doing things like word games, memory exercises, and working with numbers. These things can help maintain cognitive function and improve their quality of life.
So it's like keeping the brain active and engaged.
Yeah, exactly. You want to challenge the brain while still providing support and adapting to the person's changing needs.
Before we move on, I want to touch on prevention efforts for these disorders. Before we wrap up, I wanted to touch on prevention efforts for these disorders. Is there anything people can do to lower their risk?
Well, there was this big study in Sweden. They have great medical records for their whole population. And it pointed to three main lifestyle factors: managing blood pressure, not smoking, and staying active, both physically and socially.
So it's those good old healthy habits we always hear about. What's good for the heart is good for the brain too, right?
Exactly. Taking care of your body, keeping your mind stimulated, and having those social connections, those are all key for a healthy brain and reducing your risk of dementia.
That's good advice for all of us. But before we go deeper into prevention, I want to circle back to something we talked about earlier: cortical versus subcortical dementia. You said that cortical dementia, like Alzheimer's, often involves language problems, while subcortical dementia affects motor skills and executive function earlier on. The source material also mentioned differences in mood and behavior.
Right. People with subcortical dementia, like those with Parkinson's or HIV-related dementia, often experience more severe depression and anxiety compared to those with Alzheimer's.
That's interesting. Do we know why that is? Why would damage to those subcortical areas lead to more mood problems?
Well, we think it's because those neural circuits that regulate mood and emotion are disrupted. Subcortical structures like the basal ganglia, thalamus, and brainstem, they're all really important for controlling emotional responses. When those areas are damaged, it can throw off the balance of neurochemicals like dopamine and serotonin, which are involved in mood.
That makes sense. It helps to connect the dots, between brain structure, brain chemicals, and the emotional experience of dementia.
Exactly. Understanding the brain better helps us provide better support to people facing these really challenging conditions.
For sure. And it shows that we need to address those mood problems as part of the overall treatment plan for dementia, right?
Absolutely. It's not just about managing the cognitive decline. It's about the whole person, their emotional well-being.
Okay. So back to prevention. Are there any other promising things researchers are looking at besides those healthy lifestyle choices?
Well, there's a lot of excitement around cognitive training programs, like brain training apps and games. They're designed to challenge and strengthen cognitive skills, like memory, attention, and executive function.
So it's like taking your brain to the gym.
Yeah, kind of. And some studies are showing that these programs can actually improve cognitive function and even delay the onset of cognitive decline.
Really? That's pretty cool. It means we can actually do something to protect our brains as we age.
Absolutely. It's about being proactive and making those investments in our cognitive health, just like we do with our physical health.
Love it. And while we're talking about being proactive, the source material also talked about early intervention being really important for some of these neurodevelopmental disorders.
Yeah, that's crucial for things like ASD and ID.
Yeah.
The earlier you start, the better chance you have of maximizing a child's potential and improving their long-term outcomes.
They talked about a study where kids got an intensive preschool program along with medical and nutritional support. And they ended up with much higher IQ scores than kids who didn't get that extra education. That's pretty amazing.
Yeah, it just shows the importance of investing in those programs that give kids comprehensive support, especially those from disadvantaged backgrounds. It can really level the playing field and give everyone a chance to reach their full potential.
I love that. Speaking of potential, one of the things that really stuck with me as we were talking about all these disorders is just how incredible the brain is, how adaptable it is.
It's pretty amazing, isn't it? Even when there's damage or things aren't working quite right, the brain can adapt and rewire itself. It's like it's always changing and evolving.
That's encouraging, especially for those dealing with things like dementia or traumatic brain injury. There's hope.
Absolutely. Even with significant cognitive decline, there's still potential for growth, for learning, for meaningful connections.
The research talked a lot about supportive communities and interventions focused on helping people be independent and have a good quality of life, even with cognitive impairment. It's not just about treating the symptoms, it's about helping the whole person.
Right. It's about creating an environment where they can thrive, even if there are limitations.
That's awesome. Something we haven't touched on yet is this thing the research mentioned about how learning disability diagnoses aren't evenly distributed across the U.S. Apparently, wealthier states have a much higher percentage of kids diagnosed with learning disabilities than less affluent states.
Yeah, that's a really interesting finding. Kind of surprising, right? You'd think learning disabilities would happen at about the same rate everywhere.
I know. What could explain that?
Well, one possibility is that wealthier school districts just have more resources,
Hmm.
more specialized staff, better access to testing, more awareness of how learning disabilities can look.
So it's not that the kids in wealthier areas are more likely to actually have learning disabilities, but they're more likely to be diagnosed.
That could be it. Another factor could be parental advocacy. Parents with more resources might be more aware of learning disabilities, more likely to get their kids evaluated, and better able to navigate the system and get services.
Yeah, that makes sense. It goes back to those disparities in access to healthcare and educational resources.
Absolutely. It shows that we need more equity in how we identify and support kids with learning disabilities, no matter where they live or their socioeconomic background.
This has been a truly fascinating deep dive. We've only scratched the surface, but we've learned a lot. From the genetic and neurobiological stuff to the latest research on treatments and prevention.
It's been great exploring these topics with you. Hopefully our listeners will want to learn more too.
I think the biggest takeaway is that these aren't just diagnoses in a textbook. They're real-life experiences that shape the lives of people, families, and whole communities.
That's so important to remember. It's easy to get lost in the technical details, but it's all about understanding the human side of it and creating a world that's more inclusive and supportive.
Well said. For our listeners who are going through these challenges, whether themselves or with loved ones, we want to offer a message of hope. There are resources out there, communities that can support you, and research that's making a difference.
Keep learning, keep advocating, and keep believing in the brain's power to adapt and overcome these challenges.
Now, as we wrap up this deep dive, I want to leave our listeners with a final thought. We've covered so much, but I think one of the most important things to remember is that these aren't just medical diagnoses, they're lived experiences. They shape the lives of individuals, families, and whole communities.
It's so easy to get stuck in the technical details. But at the end of the day, it's about people and finding ways to create a world where everyone feels supported and included.
Perfectly said. And with that, we encourage you to keep learning about these topics. There's so much information out there, and the more we understand about the brain, the better we'll be able to help those who are facing these challenges.
And who knows, maybe some of our listeners will be inspired to contribute to the research and advocacy that's going on.
That's a wonderful thought. And speaking of knowledge, I think it's worth highlighting something the research mentioned that's pretty thought-provoking. It turns out there's a big difference in how learning disabilities are diagnosed across the United States. Wealthier states have a much higher percentage of kids diagnosed with learning disabilities than less affluent states.
That's interesting, isn't it? It seems counterintuitive. You'd think learning disabilities would occur at about the same rate everywhere.
I know, right? It's like, why would where you live affect whether you get diagnosed with a learning disability?
There are a few possible explanations. One is that wealthier school districts just have more resources to identify and assess these things. They might have more specialized staff, better access to testing, and more awareness of the different ways learning disabilities can present.
So it might not be that the kids in those areas actually have more learning disabilities, it's just that they're more likely to get diagnosed.
Exactly. Another possibility is that parents in those areas are more likely to advocate for their children. They might be more aware of learning disabilities, more likely to seek out evaluations, and better equipped to navigate the system and get services.
That makes sense. It points to those broader issues of access to healthcare and education.
Absolutely. And it highlights the need to make things more equitable. We need to support kids with learning disabilities no matter where they live or their socioeconomic background.
It's a reminder that even in a developed country like the US, there are still systemic barriers that prevent some kids from getting what they need to thrive.
It's a sobering thought, but it's a call to action. We need to advocate for policies and practices that make sure all children have access to the resources and support they need.
Well said. We've talked about the challenges, the causes, the treatments, and the prevention of a whole range of neurodevelopmental and neurocognitive disorders. But one of the most amazing things that kept coming up was the brain's incredible ability to change and adapt.
Yeah, plasticity. It's amazing, isn't it? Even when there's damage or things aren't working right, the brain can find ways to adapt. It's a reminder that we're constantly evolving and changing.
It gives me hope, especially for people facing things like dementia or traumatic brain injury.
Yeah.
Even when there's significant cognitive decline, there's still room for growth and new connections.
Exactly. The research emphasized how important it is to have supportive communities and interventions that focus on maximizing people's independence and quality of life, even with cognitive impairments. It's not about fixing everything. It's about helping people thrive.
Beautifully said. And that brings us to the end of our deep dive.
But we hope it's just the beginning of your exploration. Keep those minds curious.
Thanks for joining us on the deep dive. Until next time. It is a really interesting finding, and it makes you wonder why, right? Like, you'd think learning disabilities would happen at about the same rate no matter where you live.
Yeah, it's kind of a head-scratcher.
Eh.
But there are a couple of possible explanations.
Okay, like what?
Well, for one, those wealthier school districts, they tend to have a lot more resources.
Right, more money.
Exactly. So they have more specialized staff, they have easier access to testing, and there's probably just more overall awareness of learning disabilities and how they can show up differently in different kids.
So it might not be that the kids in those wealthier areas actually have more learning disabilities. It's just that they're more likely to get diagnosed and get help.
That's one possibility. Another thing to consider is parental advocacy. Parents in higher socioeconomic brackets, they're often more aware of learning disabilities, they're more likely to seek out evaluations for their kids, and they're probably just better equipped to navigate the system and get those services.
Right, they have more time and resources to advocate for their kids.
Exactly.
Okay, so it's not necessarily about the kids themselves, but more about the systems around them.
Yeah, and it highlights this need for more equity, right? We've
Mm.
got to make sure that all kids, regardless of where they live or their family's income, have the same opportunities to be identified and supported if they have a learning disability.
Absolutely. We've talked about so many different challenges today, from those neurodevelopmental disorders to the neurocognitive ones, and it's been a lot to take in. But one thing that I keep coming back to is this idea of plasticity.
Oh, yeah. The brain's just amazing in how it can change and adapt throughout life.
It really is. Even when there's damage or things aren't functioning properly, the brain can rewire itself, find new pathways.
It's pretty remarkable.
It is. It makes me feel hopeful, especially for people dealing with things like dementia or traumatic brain injury. Even when there's cognitive decline, there's still potential for growth, for forming new connections.
That's so true. And the research really emphasized the importance of having those supportive communities and interventions that help people maintain their independence and quality of life, even with cognitive impairments.
It's not about fixing everything. It's about helping people live their best lives, whatever that looks like for them.
Exactly. Focusing on what's possible, not just what's been lost. And remembering that we all have a part to play in creating a more inclusive and supportive world for people facing these challenges.
Well, this has been a truly fascinating deep dive into the world of the brain and how it develops and changes over time. We've covered a lot of ground, from the science behind these disorders to the latest research on treatments and prevention. But most importantly, we've explored the human impact of these conditions and the ways we can all contribute to a more supportive and understanding world. So to our listeners, we encourage you to keep learning, keep asking questions, and keep advocating for those who are facing these challenges. And remember, even in the face of adversity, the human brain has an incredible capacity for resilience and adaptation. Thanks for joining us on The Deep Dive. Until next time.